This is a case of a 25-year-old female patient who is diagnosed with trismus after tooth extraction. Her medical history is positive for anxiety and depression. She currently is taking Effexor or venlafaxine and ibuprofen. The plan is to prescribe a 10-day course of Flexeril or cyclobenzaprine, which is a muscle relaxant to help with the trismus. As discussed, it is important to check for drug interactions when prescribing medication for patients who are already taking medication. When checking the interaction between Effexor and Flexeril in Lexicomp, a D-level interaction was found. Flexeril is a serotonin modulator. Together, Flexeril with Effexor gives a D-level interaction, and we should consider therapy modification. Serotonin modulators may enhance the adverse or toxic effect of other serotonin modulators. The development of serotonin syndrome may occur. The concomitant use of agents that enhance serotonin activity should be undertaken with great caution. Patients should be monitored for the development of serotonin syndrome during such therapy. The manufacturers of some agents have contraindicated the use of certain drugs due to this problem. So what is serotonin syndrome? Many drugs pose an ability to enhance serotonin activity and are so used as a variety of disease states. The concomitant use of two or more of these agents increase the risk of increasing serotonin activity to toxic levels, causing what is known as serotonin syndrome. This syndrome is characterized by at least 3 of the following symptoms: agitation, diaphoresis, diarrhea, fever, hyperreflexia, incoordination, myoclonus, shivering, or tremor. So which management modification should we make? Because of the risk of the serotonin syndrome, I would prescribe scalaxin or metoxalon instead of Flexeril. Scalaxin is also a muscle relaxer, but does not give us a D-level interaction when added to the patient's antidepressant Effexor. Well, what does the literature say on serotonin syndrome? So serotonin syndrome is potentially lethal adverse drug reaction that may occur in patients taking pro-serotonergic medications. They reported 2 cases of severe serotonin syndrome induced by administration of cyclobenzaprine, the Flexeril, in postoperative patients already receiving other pro-serotonergic drugs. In both cases, symptoms of autonomic instability and severe agitation started within hours of initiation of the cyclobenzaprine and fully resolved within 3 days after discontinuing the pro-serotonergic drugs. We conclude that cyclobenzaprine should be used with extreme caution in patients receiving other serotonin-enhancing drugs. These patients should be closely monitored for manifestations of serotonin syndrome.